Ladies and gentlemen, to deliver the keynote address this morning, the grand patron of the College Research and Innovation Hub, Professor Rufus Akinyemi. A standing ovation, please, as he comes up. Welcome, sir.
Can you please sit down? Well, thank you very much. The master of ceremony. That was already a lecture in itself. And I wondered if there was anything to say afterwards. I thought he was talking about somebody else actually. You know. Let me just say that I love what I do. I am focused, I'm purposeful, and I just do it. But beyond that, I want to encourage and carry others along. I want to walk alongside you so that you can even do a lot better than what I'm doing. That's the summary. So this afternoon, I apologize for just coming. As our president and some member of the leadership do know, we're having an IAMRAT retreat next week. And I've been asked to chair that committee. I just arose from another long meeting of the planning committee. That's why I haven't been with you all day. Well, I would not proceed without acknowledging my esteemed colleagues who are on the ITV. Dr. Nolopade, Dr. Adeshola Adeniyi. I'm sorry, your name just skipped my mind. Dr. Olofin, yes, thank you very much. And of course, Dr. Makonjala McKay, that's how we call him. My esteemed colleague from Neurology, and Dr. Omobowale, community physician, but I know you also have interest in brain health. Thank you very much. So for the next 20-25 minutes, I'm just going to speak on this topic, achieving the Africa we want through translational health research and innovation. Now, I know this is a little, not too different from the theme of our conference this year. We're focusing on advancing research and innovation among undergraduate students for a resilient health system. That's the theme of our conference for this year. But you know, the question is, that is where we want to go. That's the target, but how do we get there? How do we get there? So I'm going to be sharing some thoughts on what I think will be strategies for us to get there. Because the ultimate of improving the health system is about improving the health of every African, so that with the highest quality of life, when we do well, when we're healthy, then the continent can be productive. We can achieve the economic goals of the continent. And as we all know that Africa is a continent of young people. The median age of the more than 1 billion Africa is about less than 20 years. So we're young, energetic. So how do we preserve and maintain the health of the African so that we can achieve economic independence through what is the role of health research and innovation in getting all this accomplished? I like to do this in every conference platform where I speak. I'm very proud of my roots in Ibadan. So, and again, because of some of our guests from Ondo, from Ife, from Lagos, from other universities around, so I'm ready to welcome us properly to Ibadan and to come UI. So this is the city of Ibadan, a city of about 4.5 million people, a city where you have a great UI, the first and the best university in Nigeria, and of course, the College of Medicine, which has been the top best medical school in Africa, I think about 2-3 years ago, and I'm sure we're still one of the very best on the continent. The University of Ibadan, as most of us do know, but for our visitors, was established in 1948 and remains by several ranking mechanisms the topmost in Nigeria. We have 30,000 students, and our College of Medicine was the foundation faculty where the university was born. I'm a neuroscientist, so you understand my bias to talk about the founding fathers of neurosciences in Ibadan. Neuroscience research dates back to 1920s and 30s in Nigeria and the 40s. And how many of us have heard of tropical ataxic neuropathy? How many of us have heard about that? Anybody in the audience? Oh my God. Right. This was a disease for which the late professor of neurology, Benjamin Oshutokum, became very famous. Because it kind of demystified the disease, including bench research and clinical trials, through which that disease was actually resolved. But there are three great men. Lambo, the first African psychiatrist, then the great Oteku, first African neurosurgeon, and Oshutokum. They were the founding fathers of neuroscience in Ibadan. In 1963, Rockefeller Foundation, through a grant, gave a grant to the Faculty of Medicine. It was through that grant that they started the Department of Neurosciences. Those are the founding fathers. So you can understand the culture of excellence in the neurosciences in Ibadan. It's been there right from the beginning. And that Maki and myself, and those of us who are working very hard to ensure that Dr. Olopade as well, Professor Olopade and Professor James Olopade. So we're struggling very hard to ensure that we maintain that culture of excellence in the neurosciences. And I'm sure people like Tubiolajide, Buluwatife Adewale, who is now at NIH in the US, we're already, building people in your generation who are already joining us to maintain that culture of excellence in the neurosciences. And Ibadan remains top neurosciences in Nigeria, and I can tell you across the continent, Ibadan remains a leading epicenter of neurosciences research. Talk about stroke, dementia, talk about what's Professor Vanadium, that's neurotoxicology. Professor Lokpade and Fumi, the leaders in that space. So we're very proud of our roots, and these are just some areas. I gave a talk on dementia last week at a meeting, so that's why it was highlighted. Now, again, like I said, labels, the last edition of the previous version of the national anthem, as this stanza, the labels of our heroes past shall not be in vain. So for me, that's an inspiring item in that national anthem that inspires what we do, so that we can sustain the culture of excellence. Now, the Africa we want. What is the Africa of your dream? What's the Africa of your dream? What do you dream about Africa in the next 40 years, 20, 30, 40, 50 years? I know some of you to Japa, all right? But even when you japa, don't forget your roots. Make sure you continue to think about Africa. Because when you japa, by the time you are a teenager or 60, your heart will draw, you want to come back home. That is the experience. Many of our seniors who left in the 80s and 90s, when you talk to many of them, they want to come back home. Maybe save for the insecurity and all that, but many people's hearts desire to be back home. So, what is the African you want, you desire? What's the African you want to leave for your children? The African Union had this vision called Agenda 2063 that was launched in 2019, 50 years from then. What is the Africa of our dream? That document is available in the public space. Very brilliant vision. One commercial system, one African passport, a network, a real network across all the capital cities of different nations of Africa. So it's a very, very big vision, very, very large vision. But you agree with me that for that vision to be actualized, health is important, isn't it? You must fix health. You need a healthy people in order to be able to drive the pursuit and the actualization of that vision. So I'm saying this to let you know that the theme of our conference for this year is a very, very important theme. Very important theme. And it aligns very, very strongly with the African 2063 vision of a healthy, strong, robust continent in the next not less than 50 years. Now, talking about advancing research and innovation. For me, that is simply talking about translational science. Because you do research at the bench and you translate to the bedside and to the community through an iterative process. Every research question, every step of the way, you must think about what is new. What new question are you asking? Or what new approach can you use even to answer an old question? So at the end of the day, we are bringing something new to the table. The Provost also spoke about this yesterday at the opening ceremony. So if you are going to be able to innovate, then you must think translationally. So that every research question that you raise, that you aim to answer, you must think about how does this benefit the common man on the street? How does it help to improve the health of Africans? So you must think translationally. And when we talk about translational research, science, it's just, it's summarized there. You're turning observations into interventions that can help to move processes forward. And that is an important contribution of digital innovation. As we all know, that is now the in thing. It's a key instrument that helps to improve health. So translational science, translational research, they're all essentially talking about very similar things. Now, this is a very reductionistic summary of translational medicine or translational science. And I'm sure some of us would have even seen MSc programs in translational medicine in some foreign universities. It's all about linking the bench with the bedside and with the community. So that even the research we do these days, you find that we don't do research without having a community advisory board, so that we can, together with the community, we can co-create ideas, right? The research ideas, we co-create them by engaging with the community. We sit with community members, we make observations in the community, and we take those questions to the laboratory, and then back, sometimes to the bench, and back to the community, back and forth, so that we can solve problems, including policies and issues that can improve public health. So talk about the translational cycle. It's a cycle, it's a cyclic process. T1 to T2, T0 to T1 to T2 to T3 is an iterative process, starting with discovery science. So that if you do research at the bench and you discover a new molecule, a new pathway, for instance, it doesn't stop at that. You then go into clinical trials, from phase 1, 2, and 3. And before you go to clinical trials, if you found, for instance, a new pathway, for instance, maybe a new pathway in the pathogenesis of Ebola infection. Now we're talking about designing new drugs. You can either design the drug or you can repurpose old drugs. And for this, you may need computational, and many of you are now savvy, in bioinformatics. And that's a great tool that is used for drug discovery. Drug discovery, you understand pathways, either you block the pathway or you enhance. Let me give a very good example. In our field, in the field of Alzheimer's disease, for instance, the ApoE4 gene, E4 allele, is the strongest risk factor for late onset Alzheimer's disease. In the work that we are currently doing, one of the things we have found is that there is heterogeneity on the effect size of the ApoE4 allele, on the association between ApoE4 allele and Alzheimer's disease in Africans. We found that there's a stronger odds of developing Alzheimer's disease among West Africans compared to East Africans, meaning that there are possible genetic modifiers that are attenuating the effect of ApoE4 allele on AD on East Africans. So the question is, what are these modifiers? Are they environmental factors? Are they epigenetic factors? Or are they some genetic loci that are interacting with the position of the ApoE4 allele on chromosome 19, causing that attenuation? Discovering that is a potential for drug discovery. You might be able to create a molecule that can mimic that effect and now work in individuals who carry the ApoE4 gene, and then you're able to reduce their risk of coming down with Alzheimer's disease in the future. So that when you discover a new mechanism at the bench, you're not just thinking about to discover, you're thinking about how would this get to the common man on the streets. And then when you do trials, find it's effective maybe in the population, then how do you bring it into public health space? Through guidelines, all right, guidelines, and it turns out the pharmacopoeia becomes maybe a molecule. After you've established its safety, it becomes something that will be useful to the entire population. And one of the goals of genetic medicine in Africa is we're driving towards a goal that when we discover new drugs from using the African genome, we don't want those discoveries to be only made abroad. We want Africans working in Africa to be at the forefront of making those discoveries. For one reason, so that those drugs can be available, accessible, and affordable for Africans. But if the drug comes from abroad, I can tell you that many Africans will not be able to afford it. So we can see that translational research on medicine, it's a continuum. It's not just, it's a process. So linking that up with the topic of the conference, innovations, health research and innovation is also a continuum. It's a continuum. It's an iterative process. And you hope that as you undertake this process, there will be improvements along the line. Again, just to show the interconnectedness of the different blocks in the translational science spectrum. So from basic science to clinical and ultimately to improve health. But we don't want Africans to be left out of this space. We want Africans to benefit from the improvement of health that will come to traditional medicine, because that is an important strategy for us to achieve the Agenda 23, having creating the Africa that we want and the African people that we want. Therefore, I see everybody who sits in this conference, based on what you have heard these 2 days, based on what you have been exposed to, I know that somebody spoke about digital health earlier today. Everything that you have heard in this conference, I believe, should produce some translational scientists from amongst people who are in this audience today, right? So that as you think of the future, think of becoming a translational scientist, so that the research you do, right, are solving problems. Part of it is getting your research products into the marketplace. All right, there's a big financial aspect of innovation, so that if you have a patent, you get into the business space, you can make money out of it. It's part of it. I'm not sure you know that that's what happens in the West. When a laboratory discovers a drug or a new thing in Harvard or in the Silicon Valley, what happens? They create a startup laboratory, and so that they can secure the patent, and of course the product gets into the market space. And that's why you have Silicon Valley or laboratories, some of them are richer than many African nations, so that we protect our intellectual property, right? We think about, commercializing our research products. Those are some of the things we should also begin to think. And you're not too young to begin to think in that way. Now, how do we cross the valley? Moving from the Africa of today, moving from the Nigeria of today to the Africa that we want. You all agree with me that when you think about how our continent is today and the continent of our dream, there's a huge gulf, true of us. And that's why many of us, I know that our plan A is to japa when we finish medical school or whatever course that we're studying, because things are so tough. All right? So how do we create the African of our dream? Is it just a utopia, or is it possible? That is the focus of my subsequent conversation. I like this slide that's about crossing the valley of death. All right? We can take this as the Africa of today, and this is where we want to be. Well, in between the two areas, there's a huge valley. You can see bones actually at the base of that valley. So how do we cross that bridge? So how do we bridge this huge gap? These challenges that exist, they've been there, they're still there. Infrastructural challenges, institutional challenges, economic challenges. The challenges are numerous. So how do we overcome these challenges so that we can move from here to here? The African Union has also produced a document which I will refer us to. I can't cover it because of our time. There is a strategic plan on health research and innovation strategy for Africa. It's available free online, and I will encourage us to go through that document. It will also enrich our thought and our plans as we think about African for the future. These are just a few strategies that I think will help us to cross that valley of death. Investment in human research capacity building, investment in research environment and infrastructure, sustaining investment and funding, research translation, data science and digital transformation, of course, research equity and effective regulation. They're very, very important. They are important strategies that I think will help to actualize the theme of our conference for this year, advancing health research and innovation towards a resilient health system for Africa. These strategies are very, very important, and I've not been surprised some of the speakers, but I've also mentioned some of these strategies that I've mentioned. To my mind, the first step is to cultivating scientific curiosity. I know that the gentleman who spoke from Dalhousie University, Canada, spoke about this yesterday. The nurse research, the research nurse. The assistant professor from Canada spoke about this yesterday. Curiosity, that thing in you that makes you to ask questions. Very, very important to cultivate a culture of curiosity. Very important. It drives persistence and discovery. There are times you remember at Thomas Edison, it was curiosity that drove him to conduct that experiment many times, up to 100 times, that didn't work until eventually he created the light bulb. That's curiosity that you have. Make sure you don't add anything to kill it. All right? It is what enables you to transform questions into actionable research, and then it may be divisive, can be epistemic or emphatic. So, with curiosity, you ask questions. We also engage in very deep learning so that you understand what has done about that question, and what are the questions that remain unanswered. That they're in every field. All right. It also helps us to grow. So you must have a learning and a growing mindset, not just to do research because of money or do research because of want to get distinction. You want to grow. You want to grow. You want to enlarge and grow your, grow in whatever field that you choose. So curiosity helps us to build skills. And of course, helps you to be persistent in pursuing a particular question. That's why you can see somebody working on a field for 20 years. Many of the people that win Nobel Prizes, they have that mindset. They continue to pursue that question until they unravel things that becomes a change, transformative findings that change the landscape. That's why it's very important for us to invest in research capacity building. So what you are doing, being part of CRIH, what you are doing attending this kind of conference, you're investing your time and energy in building your capacity. So these 2 days, you can be sure they're not a waste. The days as you spend participating in journal clubs, teams, you are building your capacity. And I must say you're very fortunate, because when we were in medical school or when we were graduates, we didn't have these sort of opportunities. So it's a great investment. The overall goal is to raise giants and champions that can help to transform Africa that we want. Now, growth, when we talk about growth, we must think about our research capacity building. The individual is very important, and that individual is you. All right? And one of the things you must think about doing, if you really want to build research capacity, beyond your basic degree, you must acquire research training through master's or doctoral training. You must think about that when you finish your current undergraduate course. Even if you decide to specialize as a doctor, for instance, make sure you get a research training, an higher degree. It's very important for you to build your capacity. It's also important for us to build a very strong research environment. Very important. And that's why we're very proud of Ibadan. I can say that we have very strong research environments. Basic neurosciences on the main campus, Professor Olopade's lab. We have IAMRAT as a hub. And I'm also proud to tell you that we are investing heavily in the Biomedical Research Centre that I lead now. But we have a wet lab space. We have a space for dry lab, bioinformatics. We're trying to build that. And of course, we engage richly with our community to ensure that we could create research ideas with the community. So investment in individuals, research environments are very, very important. And that's why people grow from individual researcher to a laboratory to a center and then to an institute. I've seen that model. As a single researcher, you build your team. Your team grows until you eventually have a center of your own, even an institute that is built around the single research question that you're pursuing. I've seen that a lot, and especially in many centers abroad. So again, individual growth, institutional growth, and of course, the environment is very, very important. So these are levels of growth in building research capacity. And that's why, again, I'm very proud of CRIM. CRIM is already a community of great individuals. Many thanks, and I want to celebrate Professor Adeshola Ogunniyi, the founding father of CRIM. Let's appreciate him. CRIM was born as baby on 11th of April 2019, and CRIM has already achieved and is achieving a lot. But I can tell you, we have not yet started. CRIM is going places because everybody who passes through CRIM, our goal is to make you a giant, so that wherever you find yourself after you go through CRIM, you are going to change the landscape. You're going to be a transformating, an agent of transformation in every space where you find yourself. Now, I want to again emphasize a culture of excellence. In CRIM, we are building a research culture, but it's a culture of excellence. As I told you, a culture of excellence that was built by the founding fathers of neurosciences in Ibadan about 60 years ago, has continued to propel what we are doing in neurosciences. That is the same thing we are building in CRIM, a culture of excellence, so that wherever you go, you become an agent of transformation. That's the vision that people like Oshidokun had, the same vision that we have. I want to be couriers of that vision, wherever you find yourself in the nearest future. Funding is very important for research, as some of you already know. And I'm proud of many of you guys who are already winning grants. And I hope you will teach me the strategy of winning grants. I saw him, the house officer in Nondo. Yeah, real one. He's a grant winner. Tobelajide wrote a grant that brought in the Neuroscience Next Conference last year. So we have there are several others. I just mentioned those two, but there are several others. Even as undergraduates already winning grants. We're very proud of you. And hope you come and teach us some of the strategies. All right. So they can win. You also can win grants. And I can tell you that money is very, very important to be able to do grants, do important research that can change the landscape. In Ibadan, this is just an example of our stroke-funded research projects. They're all funded in our stroke research team. So you can see the records. This is not all, actually. There are a few additional newer grants that I've not listed on that table. I'm just trying to show us that unique, consistent, and sustainable funding to be able to do good research that can be transformative and make impact. All right. In the space of dementia research, these are some of the very important grants that were won. Even this project lasted 20 years, consistent funding. And that's why it remains a landmark across the continent and even globally. And we're built on that foundation, bringing a bunch of some new grants, and the goal is to take the study to the next level. So that our goal is to be able to understand the biology of these diseases in Africans, so that we can find solutions, find drugs that can help our people. It's the time has come for solutions to arise from Africa for Africa. We shouldn't think only about importing solutions from abroad, because you have what it takes. You have what it takes to get those solutions, but we need funding to be able to accomplish that. Now, brain health is very important. Please, sorry, I'm speaking as a neuroscientist, so please take care of your brain. Brain health is very, very important. Take care of your brain, because it is through your brain that you generate research ideas, isn't it? Research ideas, innovations, everything comes from the brain. So take very good care of your brain, right? And there's also a move across the continent, strengthening brain health and economic resilience. And I'm showing that slide to show you that there's a very strong connection between economic progress and research and brain health. All right, they're strongly connected. And we have an African task force that are working on this, working with other African leaders, to promote brain health across the continent, and for the purpose of economic renaissance and resilience, for all Africans. Now, the power of working together is also very, very important. How many of us have heard about the principle of Ubuntu, the Ubuntu principle? All right. The principle is, I am because we are. All right? A house divided against itself cannot stand. The story you see here was actually a story that somebody told. An anthropologist went to a village, gathered children together, and then brought a basket of fruit and put it under a tree and told the children, the first person to get to the basket of fruit will be the owner of the basket. What did these children do? What did they do? The children, rather than running a rat race, so we know who is going to be the first person to get to the basket, what did they do? All of them held their hands, and they all moved towards the basket together. So that when they got to the basket together, it wasn't just one person that was a winner. They were all of them together were the winner. The man asked them, why did you guys, why did you do this? They told the man that I am because we are. In other words, our common goal, our working together produces greater results than what I can achieve alone. And that's why somebody said, together, everybody achieves more. So it's very important to work together. Think of how we can win together. Not just one person winning the trophy and others, but working together. And that's why in CRIM, we have different working groups, different journal clubs. That is the way to go. Even these days, everybody talks about team science. That's why you read papers in Nature. The biggest paper that enter Nature are papers of not one author, sometimes hundreds of authors, over 1,000 authors. Most of the papers in Lancet, that's the way it is. And that is the way to go. So let's cultivate the habit of working to become a giant Iroko tree. Every relationship you have is a seed. Your relationship with your mentor is a seed. Please water it. Water it. Water it. The small study research you will do as an undergraduate is a seed. Those publications you are generating as members of CRI, they're all a seed. Don't underestimate their power, because those publications, they are going to open doors for you. By the time you are looking for placement in Harvard or Johns Hopkins, so please, every opportunity you have is a seed. Maximize it. There's a lot to say, more to say about that, but because of time, I'll just move on. But I'm sure you understand. Don't underestimate the power of a seed. Let me just cite one example for you not to. Every idea you have is a seed. If you try to get a grant to do it and you're not getting the grant, don't give up. Don't let that idea die. There's a research idea that
Okay, any questions for Prof? Okay, thank you very much. Round of